Hi, everyone. My name is Gill Eapen. This is the Decision Options podcast, and my co host is Dr. Ian Williams. And this is a new format. So, we are just going to talk about stuff that comes to our mind or on the internet, which is equivalent, I would imagine. And so Ian, you had some ideas you want to talk about. So, let's start with that, and
Yeah,
then we go from there. Yeah.
okay. So clearly, what's getting a lot of press at the moment is longevity. As I think virtually everyone watching this program is well aware that there are several drugs, old drugs, that have been around for many, many years, decades in some cases, which appear, certainly in animals and also to some extent in humans, to prolong life. And of course, this has been the
Like metformin, for
yeah,
instance.
like
Yeah.
metformin, rapamycin, just to pick two that um, people are actively using.
Yeah.
Um, and we can come
So
back
is
to
the so sorry and sorry to interrupt. So
sure.
is rapamycin approved?
Not for longevity.
Not for longevity, but
Oh
what
no,
is it
yeah,
approved?
rapamycin is approved. It was an anti-cancer drug, I believe.
Anti-cancer. Okay.
Yeah,
Okay.
yeah. And metformin has been approved for I think more than 50 years for the
Yeah.
treatment of type 2 diabetes.
Yeah.
So we have these two drugs, and in fact, metformin is really, I think, the pioneer in this area because of the millions of people who've been taking it for diabetes. It's been noticed that type 2 diabetics who take metformin
Mm.
live longer and suffer less cardiovascular problems than those who take other oral anti-diabetic agents.
So
Um,
so when you say they live longer, is it against the cohort of type 2
it's a,
diabetics?
it's
Or
yes,
is yeah.
it's against a cohort of type 2 diabetics, and it's been controlled for um, uh, glucose control. So it's
Yeah.
not comparing them to a population that's been on other oral or hypoglycemic agents or insulin,
Yeah.
um, independent of what their glucose control is, as measured by um, hemoglobin A1C or other parameters. So this has become apparent, and that then stimulated a number of people to start exploring metformin and to try and see what was going on here. So there have been lots of studies done in, of course, the prototypical, C. elegans,
Yeah.
mice, etc., And there
But
are,
yeah, so sorry. And so what I'm wondering is though is that clearly if you are pre-diabetic or type 2 diabetic, um, having metformin-like agents are very useful. And as we know, diabetes is a bad disease. It gets into all sorts of problems. So so when you say metformin is sort of increasing longevity in pre-diabetics and type 2 diabetics, are we just saying that it is actually a good agent for sort of glucose control, or is it something more than that?
well, that was my point. So if you normalize for glucose control,
Yeah.
and there are many parameters you can do that. Hemoglobin A1C used to be one, but now with the advent of continuous glucose monitoring devices, you can look at mean glucose, standard deviation. So if you control for that
Yeah.
and look at hypoglycemic agents, including insulin, because many type 2 diabetics end up on insulin,
Mm.
compared to metformin, the cohort on metformin had a longer life.
Mm.
And it's of several years. I can't cite the exact data, but it's well reported. And it was compelling enough to, as I mentioned, stimulate scientists to start and clinicians to start investigating whether just what metformin did or does
Mm.
and how that might come about. Before we get into the details of that, though, I just wanted to step back a little bit and just try and set the scene for our discussion. So,
Yeah.
my assertion is that there are these agents out there that in humans and certainly in rigorously controlled animal studies appear to prolong life. And I think it's just a very interesting topic. Clearly, this excites a lot of people, and it's generating a lot of interest in companies and also major academically funded clinical trials. And so the question then comes into my mind, well, it's more of a social science issue. Is this a good thing for individuals? Is it good for society? What are the consequences of that for society?
Yeah.
What are the implications as the world birth rate is dropping outside Africa, but certainly in the rest of the world? And should we be addressing those problems in consort with pharmacological and medical attempts to prolong life?
So we have lifespan that is from birth to death. There was a concept called health span. I think it is sort of little nebulous, but what that is supposed to indicate is that health, when you are living healthy, you have a health span, but extending life for the sake of extending life may not be that great, making a statement here. Um, and then I was thinking about some sort of utility span, which is if if I'm not really so for instance, let me make a statement and I'll let you react to it. If I would say if I'm not contributing to a system, society, whatever it is, it doesn't really matter if I live or not. And so there is sort of a utility span, at least for some cohort of people. And so when we set out to maximize lifespan or maximize health span, there are a lot of societal implications here, as you mentioned, and a lot of policy implications, right? Some people, if the utility is going to zero, they might be healthy, but they may not want to continue. And so, the flexibility that we should design into society, my bias would be that it's an individual freedom issue. How long one wants to live, and so this gets very complicated, doesn't it? I mean, what do you
Yeah,
think?
it does. Well, I have to react to a couple of things that you
Yeah.
said, and I think this is what makes this subject so interesting because it's so difficult to come to the grips with all the implications. But let's just focus on utility, which I know you're a great utilitarian. The definition of utility can vary enormously, and
Yes.
it can be the ability to call one's grandchild and wish them a happy birthday may be of enormous utility to the child, its parents, and to you, as
Yes.
much as contributing to the GDP or whatever other parameters
Yes.
you care to adduce. And equally well, there are many people today who have very little utility, although they are robust in health and are quite of a young age. I think one way, perhaps, and this raises another very emotive and nebulous factor, is of course euthanasia. So one, just for the sake of discussion, imagine that indeed, yes, some drug or procedure were developed which increased the lifespan. So currently, I think it's around about 80 years plus or minus, men and women. So let's say we could push that to 100 for the average person, and if they also had the ability to end their life,
Yeah.
but for any reason, no, not just because you've got some horrible terminal disease, but also perhaps they're lonely, they don't know anybody, they're fed up, they're depressed, they've had it, and they just don't want to carry on living. Now, let's not get into at this stage, although we can revisit that later or at another session, the morality and implications and ethics of euthanasia. But if that were the case, I don't think the utility argument is particularly useful because who's going to assess that? And if it's self-assessed,
Yeah.
then if you have euthanasia as an option,
Yeah.
it goes away, right? So if you feel you're useful,
Yeah.
now if you're suggesting then that all these 80 to 100-year-olds are now a burden on society, which they may well be. I mean, we're already facing that with the decreased birth rate,
Yeah.
decreased wages,
No, no,
decreased taxation, et cetera, et cetera, et cetera.
I'm not suggesting that at all. I'm saying
Oh,
the individual has an assessment of his or her utility function.
yeah.
And if there is an individual freedom, I mean, euthanasia is one thing, but euthanasia, typically we think about, the lifespan is very limited or the health span is already gone. You are in a situation that you don't, the quality of life is not very great.
Yeah.
What I'm arguing is that there is a utility span question. So society has an obligation to say, some kid, 20-year-old kid getting depressed wants to take him or her out of society may not be a good thing, because it's a very tactical decision that doesn't really take into account sort of the longitudinal, utility question. But then as we progress toward, end of life, not necessarily end of life, actually, as we progress toward um, old age, then there is a true utility question, uh, so, do you really want to go to an old age home? Um,
But as long as those things are
yes,
personal choices, I
yes,
don't see
yes,
that
yeah,
there's a problem, right?
yeah.
I
No,
mean,
it's a personal question. Yeah, yeah.
yeah, yeah. So, I mean, I think the other interesting issue is, again, coming back to my original assertion here. If there were a drug
Yeah,
that extended life on average 20 years, right? If you started taking it at an age of responsibility, 16, 20, whatever that is,
yeah,
you have the choice not to take it, right? First of all.
yeah.
And secondly, if you do take it, you can always stop taking it. And thirdly, um, once you start taking it, then uh, if the effects stop quickly, which is hard to imagine, that could
Yeah.
be the problem. So let's say you're taking the drug, you hit 75 or 80, and I've had enough of this. So you stop, I don't like my life, I don't want to continue.
Yeah.
Euthanasia is not an option because it's just illegal, except, of course, now you can go to Switzerland, Oregon, all kinds of.
Yes.
But let's say they disappear for whatever reason.
Yeah.
Then you're kind of stuck because then you're going to have to put up with this extra 20 years of life. So that's a danger. But I don't think it's any more of a danger or risk than all kinds of behaviors we indulge in, whether it's smoking, drinking, riding motorbikes, or whatever else people choose to do, skiing, or eating hamburgers. So, I don't really see this as too much of a problem. I think the thing that is interesting for me is the macroeconomic consequences of
Yeah.
this. As you've already put out there, will these people ipso facto become a burden on their society? The current feeling now is yes, because they're going to fall over more. They don't have such a good memory. Or is everything else going to move along? Which gets back to a health span issue. So
Yeah.
if 100-year-old is as functionally efficient and effective as a current 80-year-old, then it shouldn't make that much difference. And indeed, we should be able to shift everything then. So instead of retiring at 60, 65, we could move that to 70, 75, which have enormous implications for productivity, GDP, assuming, well, that also, I was going to say, assuming that the intellectual competence remains the same, but you might get a whole different level of competence because of experience, even if certain executive functions and speed of thinking or whatever deteriorate. And again, do the drugs prolong all of these things, or is it just the mechanics of the body, the biochemistry, and not the intellectual function? So there's a lot of issues.
So I want to push on this a little bit, Ian. So from a policy perspective, in an environment where population is increasing, most of us lived in that environment. We're going to flip over to something dramatically different in which the population of the world is decreasing.
Right.
We're not too far from there.
Right. I think we're actually close to that tipping point.
Yes. So in that world, all the policy optimization that we have done previously uh, not going to be useful because, as you say, experience has a lot of value, and most people with experience, if they're in pain or low health span expectations or low utility span, I would say expectation, they don't want to continue. But then their value to society has infinitely increased in an environment um, where population is decreasing. I mean, we never been.
Yeah,
Um,
no, exactly, exactly.
yeah, yeah,
And if you buy that argument, so let's
yeah,
again make another, um, not a hypothesis, but an assertion, you know. So let's say that these drugs we've been talking about, or some yet to be discovered, increase not only lifespan, but health span, but also maintain intellectual function or competence, however one wants to define that.
yeah,
If that's the case, given the fairly rapidly decreasing population outside of Africa, then that would be a huge benefit for society, at least as it's currently configured. And
yeah.
so, if that did come to pass, you'd think it would behoove governments then, or behoove governments to put money into this kind of research. Okay, so you can't encourage people to have more children because that just doesn't work. We've seen that a million times. Economic incentives, etc., they just don't work.
Our president is trying, though. By the way.
Yes, many have tried. None have, to my knowledge, have succeeded. Just look at South Korea today. I mean,
Yes.
it's amazing. Anyway, let's not get sidetracked on that too much at the moment. But okay, so if I were the South Korean government, I've got this decreasing population. I haven't done much to stimulate immigration. I would be, shipping people in from Africa if they'd like to come, but that causes all kinds of societal problems, as we well know. So I think I would be very interested in prolonging life of my current population, to help maintain the GDP and all the social infrastructure and the current gestalt in which we operate.
Yeah. This might be pushing it a little bit too much, Ian. So, so stop me if you. And so there is still a utility question, which is, sort of. So let's say population is declining. I want to keep my population, but then on the end of that population spectrum, the differentiated population I want to keep are quite different. I mean, I don't know that on the beginning of that spectrum because these are kids
Yeah.
learning or going to school or whatever. On the back end of it, I have a really good sense if these people are going to add value to society or not, right?
Right.
And so from a policy perspective, I wondered, where this is going to lead us ultimately.
Yeah, that's a very interesting point because, I mean, it has the spectre of eugenics hovering over it, okay? But as you say, since if you make the assumption ab initio that you can't determine who's going to be a utilitarian asset to your society, so everyone gets the drug, right?
Yeah.
Then I think you could just simply say, morally and ethically and enshrined in the Constitution, if it's a democracy, that we will just continue to operate as we have. We've been working on that, okay?
Yeah.
So if you take a population that in the 1950s, we'll call it 100 units, and now it has a population of 50 units. If you can restore that to 100, I mean, now, as we said, the key issue is that extra cohort that now exists really going to justify, their worth? Very difficult to answer. But I think the other thing that has to be stirred into the mix here, as I mentioned earlier on about the grandparent, or maybe the great grandparent calling their
sort of a micro utility issue.
Yeah, exactly. The happiness, perhaps,
Yeah,
to talk to our Finnish cousins. Is
yeah.
part of their happiness inculcated by
Yes.
having vital and healthy elderly population. And by elderly I mean the wisdom and experience and years and traditions, not just age per se. So as we scratch the surface here, I think it's an enormously complex issue. But I think if I were king for a day, I think I would be definitely encouraging and trying to stimulate pharmaceutical research into life extension. But as we've also said, I mean, there are many scenarios where this could become a real problem. And I think not least of which, if you look at I think it's true in America. I think it's probably true much more broadly, and you may be able to answer this.
Yeah.
Clearly, wealthy people get access to drugs, and poor people, on the whole, do not. So that's already starting to then have a skewing effect. So does that only mean that wealthy people, and unfortunately they also seem to have access to more education and yada yada yada. So your question earlier may come into pass just because of our broken healthcare systems. Lots of issues stimulated by this. I mean,
sorry. Yeah.
Go ahead.
No, so I was just saying, I was just thinking that we haven't experienced a universe a world where human resources are the most valuable resource. We all lived through an era where, I mean, most of the policymakers have still continued to live through this idea that you have to get people out of your country, which is such a crazy notion based on the data that we can see. So when we get there, which is not too far, all the roads, all the airports, all the train stations, at some point there'll be nobody there, and most people don't believe it, but we are very rapidly approaching that, because the replacement rate for humans is approximately 1.2 or 1.3 or something like that. Except for Africa, as you said, it is substantially lower than that. So, so we are rapidly approaching a point where, there may not be too many humans. So, we talked about AI last time a little bit. Everybody's worried about AI replacing humans. I'm more worried about there won't be any humans to actually do the AI stuff.
I'm sorry, I've got to interject there, Gill, because it's one thing to talk about decreased birth rates and everything. It's another to talk about empty stations and what have you. I mean, I think there is, to take you pick transport and other infrastructure issues.
Yeah.
Well, increasingly, as COVID has shown, and just economics have reinforced, you don't need those things. Right, you can do a huge amount of things virtually, as we are doing now.
Oh, sure, yeah.
So I don't need to get on the train to come and see you or fly or whatever it may be. So there is that, and also, and I know you're a great. What can I say? It's a very provocative thing, which we can talk about later or on another thing. You say there's been no new sort of invention by humans since Einstein, but you either take the view that 1 out of every X humans is going to make a significant contribution, however one determines that. So there are only in order to get Leonardo's, Michelangelo's, Newton's, etc., you've got to start with X million people. Well, that may not be the case. So if we got 8 billion now, then those that are fortunate enough to be healthy and to live somewhere where they can reach maturity and do something. Are you just saying that the probability that we'll have more Einsteins if we start with 8 billion than if we start with 1 billion? I don't know if that's true or not. I mean, I simply don't know.
Yeah, so I would argue that this is not aggregate statistical question. Between 1900 and 1930, there were so many brilliant people. It's like that ratio to brilliance to aggregate population was a lot higher than any time in the history of humans. Well, the history that we have data on. I mean, the guy who invented the wheel. Pretty good.
She should be up there. She should be up there.
Yes. And so it's not an aggregate statistical sort of longitudinal question, meaning, if I take 8 billion, out of that, 0.001% would be brilliant. There's a longitudinal issue here, which is, as we have seen, between 1900 and 1930, there was significant development in physics. I'm just thinking about physics primarily here. And that has never happened. That certainly hasn't happened since then. And I'm not sure it happened before that. So I don't know if we can take a denominator and divide it and say, well, you get 0.002% of this people.
That was my point.
Yeah. Okay.
So in other words, it doesn't matter if you only have 1 million people. You don't need a billion people. You don't need 8 billion in order to come up with new ideas and live a life where the current things that exercise political thought now, vis-a-vis, have we got enough roads, railway stations, electric cars, or whatever, are sort of irrelevant, And then also coming back a little bit to the AI issue, whilst we might disagree on the potential of AI, one thing it can do is a lot of robotic functions with a higher level of sophistication that is going to put a lot of people out of work. So again,
that's definitely going to happen.
That's definitely going to happen. So you don't necessarily need these. So you could take another view, as we were starting on this whole thing about life extension, well, maybe that isn't something that government should fund because we're not going to need that many people. We could get by in terms of economic, let's call it GDP for want of a better term, on far fewer people. Now, people will push back on that and say, well, look, have computers really done anything when they were introduced in the 1970s? But I think it's going to be the case that a lot of manufacturing and intellectual, a lot of innovation will be automated. I really do.
Yeah, so that's a really interesting thing, Ian. So it has to be coupled with policy. So as a guy who like economics, I'm a big proponent of minimum guaranteed income.
Yes.
And I think we're heading toward a world where we have to free humans so that automation can sort of take over.
Yes.
And there's a natural sort of good thing happening here, which is number of humans are declining.
Yes.
Which is also, I would think it's a pretty good thing. And so, there is this question of policy here, which is if automatons are going to take over all the jobs, a lot of the jobs are going to be taken over by automatons. There is no way to stop this.
Right.
It is there. And so the policy axis has been, let's get all these people who are jobless to get them back to school, get them retrained and all of that. I think that's the wrong policy. I think we have to get people, we have to free people to go do whatever they want. I mean, if it's the art, music, literature, I don't know what they are, but we just have to give them sufficient money to go do that.
Yeah.
That would be my policy.
Yeah, I mean, this takes, well, it's folded in and intrinsic to what we're discussing. But my response to this, which I think would be pretty universal in everything that I've read, is the correlation between happiness and purpose. When people have a purpose, they tend to be happy and motivated. When they have no purpose, regardless of their material wealth,
Yeah.
they tend not to be. And now purpose varies hugely. It can be simply, taking your kids to school or helping them with their homework, or it could be, trying to save the Amazon. But I think people then, the education, for want of a better word, needs to change away from training to do something, whether it's physical or intellectual labor, towards realizing a purpose. And what that could be, who knows? And it would vary according to culture and all kinds of things. But I think that would be the first step that I would try to. I do remember in my early career, there was a fellow, a consultant, whose job was, her shtick was to help you find your purpose. And he did all kinds of stuff, and this, that, and the other. And it was actually quite good. And, he would go outside a little bit from, the technical training aspects that you've had to what excited you and what stimulated you and how could you incorporate that into your work environment. So I think that would be, but I agree with you. If you're going to, and I too am a big advocate for a universal income wage, but you have to be able to avoid frustration, dysphoria, an ensuing revolution, right? I mean, just people will say, I want to have my job back. I want to make bread. That was a really good job. I enjoyed it. I fed people, whatever it may be. And now the machine's making the bread, I'm worthless. So these are all, what's so interesting, I think, about this conversation, we could take it a million, just go on and on and on, right? is whether there is something now. Are we at this interesting point where it feels to me we're on the cusp, as in so many technical areas of major. So whether it's quantum computing, how that will change the world, it's all these various things.
Yeah.
If we do indeed come up with a longevity drug, some company will make it and somebody will take it, no doubt, And what is that?
We have a longevity drug. You put rapamycin, metformin, some bit of statin, like atorvastatin into it.
Yeah,
and
a beta blocker.
I can make it.
That's right. That's exactly right. THA, propranolol, statin, and an aspirin. You'd be that.
You live forever.
Yeah. Well, certainly the health budgets of all the countries would be fine. Anyway, now that we solved that problem.
So I want to go into another topic, which is really interesting to me. So I think you've seen this. So I just went to the health area of Science News, and it says autism rates rose again. Autism rates rose again. Experts explain why. They say here autism rates are higher than ever before. I think it's US data. Don't know. Probably because of more expansive and sensitive diagnoses. And those numbers highlights the need for more support for people with autism. Yeah. So this is a little bit of a problem and a solution. The problem part is, we keep changing this diagnostic metrics. So in India, for instance, where I grew up, A1C of 7 is considered pretty normal. pretty normal.
Hmm.
A1C of 7.0, in the US is considered like full-blown diabetes, right?
Right.
Um, and so there is an issue in terms of metrics, and so this is clearly the case that about 1 in 56 was diagnosed with autism like 3-4 years ago.
Yeah.
Now it's 1 in 32 or
Yeah.
something like that. So it's a
Correct.
dramatic increase
Yes.
in the diagnosis of autism. So the question would be that is it because we changed the diagnostic metrics, or is it something more fundamental happening?
Yeah. So I have thought about this, and I have a couple of thoughts. One is I think you're right. I think the DSM criteria for clinical diagnosis of autism has shifted, no doubt, to be more inclusive. And that's happened in a number of diseases. I mean, blood pressure is another interesting example where there's
Yeah,
a difference between Europe and America on what's
yeah,
considered, you know. But the thing I think that's more likely in my mind to explain this is um, the impact of the internet and social media on our society in
mm,
two aspects: parents and children.
mm,
So I think for children, I mean, this has been endlessly discussed, right? Living in a virtual world, the stress of likes, not likes, whatever platform they're using, can be, and the use of video games and what have you, could perhaps promote autistic traits,
mm,
isolation, decreased ability to interact socially, decreased ability to read emotional signs, a decreased competence in theory of mind and be able to ascertain what other people's actions and thoughts are. Let me just
so
finish one thought before you
yeah,
say.
yeah,
So there's that possibility
yeah,
leading to hyperactivity, lack of concentration, etc., etc., etc.
mm,
And then parents that, and I think this is increasingly because of the changes in the world,
mm,
global warming, wars, movement towards right-wing politics, etc., parents are stressed. And so you have a stressed carer, stressed child, and
mm.
I think one way that that shows itself, perhaps, might be this apparent behavioral abnormalities which are now being typed as autism.
Mm.
So that's a thought I had.
Yeah, yeah, it's really interesting, Ian. Um, so you're thinking about autism as a sort of a progressive disease.
Yeah.
My ingoing bias would have been hardware related, systematic, meaning I can pick up a 3-year-old kid and I can assign a probability that kid is autistic. But what you're arguing here is more environmentally driven, societally driven. Autism is sort of induced phenomenon.
I think there
Uh,
are yes, I think there are to be clear, I think there are almost certainly genetic components. And if you take severe cases of of autism,
yeah,
where people don't speak, they just stand against the wall, things like that,
yeah.
that may have a very, if not total, genetic component.
Hmm,
I think that there is a spectrum, and one hears people who are dealing with children, or everybody talks about a continuum. He's slightly autistic. He functions.
yeah.
He kind of functions. He has friends or so, but he's not quite, as blah 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 blah. And so you could say from extreme introversion, as it used to be called,
Yeah.
is an early stage on the autism spectrum. So yes, I do believe, much like many diseases, I mean, hypertension,
Hmm.
type 2 diabetes, there are often gradations. It's not binary. It's not like schizophrenia, perhaps, or
This all spectrum.
yeah, it's a
It's all
spectrum.
spectrum. Yeah.
So that would then speak to both environmental and genetic causes. And that
Hmm.
comes back to my earlier point: when the environment changes against a constant genetic background,
Hmm.
then you'll get a shift.
So I don't know if you watched this, Ian. So I had a podcast on sort of autism spectrum, and we talked about all the great scientists, Isaac Newton, Einstein,
Right.
Maxwell, and others. They're all sort of autistic.
Yes.
uh, he talked about sort of the systemization axis and the empathy axis. And the systemization axis on the corner are these great scientists who changed the world, and they were sort of autistic. I mean, as far as I can see, Newton didn't really want to talk to anybody.
Sure.
I was a little bit surprised that Einstein is also characterized as autistic because I think he liked a little bit people, but he liked numbers more. I can see that. And clearly, Maxwell did like people. Um, and then the other end of the spectrum, we have a few folks like Nelson Mandela or Mahatma Gandhi or somebody who only like people. It's like this is sort of a negative autistic property, uh, and that is also sort of problematic, isn't it? I mean, I don't know. What do you think?
I don't think it's problematic. So let's assume that whoever you're talking to is correct. Well, the data are the data, right? But it's very difficult to adduce what Newton was like. I mean, you have these reports from 400 years ago. Who knows, right? But in any case, let's assume that's the case, that he was indeed autistic. I mean, he may just be so bright, nobody had anything worth saying to him. Anyway, whatever. But I think that's true of any human characteristic. There's probably a bell curve Gaussian distribution, right? There are some people at this end and some at the others, and the mass of us are in the middle. So I don't
Yeah.
think that's either particularly unusual or concerning. When you started this discussion, if this curve were shifting to the left or to the more quote extreme autistic level, well, the next question that arises: are those people then, for want of a better expression, Darwinianly more fit for the society in which they operate? So if you're in a society where 90% of your information is coming from, let's just call it the internet for shorthand,
Yeah.
your job is via the internet, you have almost no real skin in the game in terms of interacting with people, trying
Mm.
to negotiate or whatever, then people who are more autistic may be much more competent
Yeah.
in the virtual, let's call it the virtual environment, in the virtual environment than
Mm.
people who are less. So that might be just a selection process.
Yeah, that's really interesting. So, I mean, we couldn't really tease this out. It could be diagnostic
Yeah, I
aspects.
think it's all of the above. I don't think there's any
Yeah,
one thing, but I think there are
yeah,
multiple factors here.
yeah. But then it's a really interesting thought, which is society, are we selecting? So, the famous electric vehicle automotive CEO is famously autistic. Um, there are a few other, really interesting people who also contemporary people who appear to be autistic. And so, if the value to autism is increasing, let me put it in economic terms, then, as you say, they will be selected. And so, if this is true, then we will find the percentage of autistic people in the population continue to increase over time.
Well, let me just,
Okay.
okay, we are, well, I was going to say, and this is certainly true a couple of decades ago, that, there's very little selection pressure in our population now.
Yeah. Yeah.
It's just not
Okay.
going to happen. But I think there is a different kind of selection, a social selection,
Mm.
economic, right? So if we follow this argument that people who are more to the autistic end of the spectrum, let's call it the left or whatever, this is, are better able to function in a business environment that's heavily virtual. I mean, Bill Gates is a classic example. He just published an autobiography, and clearly the guy is autistic. You know, I mean, he had a couple of friends. He used to hike around Seattle, but he's basically, he just loved computers from the age of 13 when he first saw one. And the same could be said of Steve Jobs, and who knows what Elon Musk is. But these people may become then the people that achieve this huge wealth and thus huge influence are autistic. So it may not. I suppose if you're a parent and you're worried that your kid's 3/4 along on the autistic spectrum, well, maybe he or she's going to be the next Bill Gates, So maybe don't worry so much. I don't know.
Yeah, I mean, it's a really interesting sort of societal policy question, which is, I know that we are not tactically selecting for these things, but in the long run, human societies might select for these things because these people are wealthier. They could buy elections, some of them, for instance.
Really? Oh, I can't imagine that happening.
And so, these things are pretty good traits to have, right?
I don't know if the viewers know of your other life here, where you're interviewing these experts in all kinds of fields. But as we were talking, one thing that has always interested me, and this might be worth exploring, I don't know whether you could get any of them to do this, is to go to venture capitalists, right?
Yeah.
So venture capitalists are sitting there looking where to invest, right? And I've been in that environment, and I have friends who operate in that environment. And the chemistry, by which I mean the social chemistry, when you make your pitch. So firstly, you send them something, you do a video, but if you're going to try and get 100 mil out of them, you've really got to go and shake their hand, right? So I wonder to what extent the venture capitalists are considering what we've just been talking about. Whether if they see a Bill Gates, does they say the ideas are so good, so compelling, the technology is so impressive, it's so well structured and thought out, even if he or she is a nerd or whatever they want to call them, this is the way to go, as opposed to someone who comes, has good ideas, but it's always risky, but they're charismatic, they're just a born leader. Whether that will begin to change, because I feel now it's very much, well, within corporations, it's all based on sycophancy, but put it that aside for a moment. So when somebody just shows up at a venture capital meeting to try and get some money, to what extent, that they shift their criteria?
So my view on this, Ian, is that the venture capitalist is an intermediary. They're intermediating capital from the capital provider to the entrepreneur.
Yeah.
And at the end of the day, the capital provider drives the process. So he puts this intermediary in place based on some hit rates or whatever, right? In the past. But the intermediary is pretty mechanical in the sense that,
I disagree, because you just said, all right, so if I'm a multimillionaire and I want to increase my wealth, and I want to invest in some startup operations, but I haven't got the time or the skill to do it myself, so I go to a venture capital company. Well, the first thing I'm going to look at is their track record, right? How many hits have they had, and that's predicated on their ability to select.
In this world where technology is changing so dramatically, track record has zero value actually. And so if you find a venture capitalist who say, hey, I want a guy, who has done it for like 50 years, that gal or guy is going to lose next time. And so I don't think venture capitalists do it like that. I think, I mean,
I
at the
don't
end of the
know.
day, they
I
have to
don't know.
provide returns to the capital provider. Yeah.
Well, yeah, exactly. So either I think, well, what you're suggesting then is it's just kind of a crapshoot, um, or if they do have a, I mean, that's what I'm interested in. That's why I suggested it. Whether the two or three of them in the companies that I've been with, there's usually two or three honchos there who are out interviewing, looking, and thinking, and I'd love to really understand the combination then
Mm.
of the data driven, what's this person, it's academic for a better example, is pitching, and to what extent is his or her personality
Mm.
important, and does it skew that way? Perhaps another way of asking this
Mm.
question is, if you look at all the the the, the investments that have been made by venture capital, if you looked at the prime recipients of that, where
Yeah.
do they fall on the autism spectrum?
Yeah. So my feeling is that there's only two or three axes. One is age. One is where he or she went to school. It's still a pretty important axis. And the third might be that some sort of history. Most young people don't have a lot of history, but I don't know if venture capitalists look at family history or whatever. But the dimensions are pretty plain vanilla dimensions: age, where you went to school, because the idea cannot be valued. The idea is a new idea. It's a it's not like the venture capitalist has infinite wisdom to say, oh, this idea is better than that idea. They actually pretty much know nothing. Most venture capitalists, we make a grand statement. Their boss is the capital provider, so they have to provide returns to the person. So that is their objective function. And so they have developed some heuristics, I would think. And for instance, the heuristics is that if you're in Silicon Valley and you're 20-year-old and you went to Stanford, pretty good. I'm going to give you $100 million. If you went to Mississippi State and you are in Missouri somewhere, probably not. And so the axes are pretty
Yeah, if
pretty
that's
clear.
if that's true, Gil, then it's sort of disappointing, and we should move on,
Yeah,
because yeah, I just find that very difficult. I mean, I suppose I would, the analogy in my mind would be back in the day, 40, 50 years ago, of portfolio managers.
yeah,
I'm working, I'm making some money. I go to somebody and say, what are good investments? And he or she says, try this, this, and this, right? I mean,
right.
if I thought they were just sort of picking them out of the air and blah, blah, blah. So I think there is some skill set there, but maybe not. So who knows? Okay.
Yeah,
We
I
got
was
sidetracked a
convinced.
bit
Yeah,
from autism, but I mean, I think in summary to our discussion,
yeah,
I think probably the big increase is, as you suggested, diagnostic.
yeah,
Second, though, I do wonder whether the societal changes that we're experiencing, both in terms of the children, but also in their carers, is
yeah,
changing and pushing that. And if you stress a kid,
yeah.
then he or she is going to exhibit more autistic behavior, going to retreat, become subdued, less gregarious, less friendly. I don't know.
Let me put a wrench into this here, and then we'll finish up. So suppose if I get my kid certified as autistic, let's say, and that kid has some advantages in the school system, or whatever the case may be. I'm just making this up. I don't have an autistic kid, so I don't know. Um, then there is an incentive to put into the system to get you certified as ADHD.
Yeah.
So ADHD and autism is a very highly correlated disease states, as you know. And so there are incentives put into the system to say, yeah. my kid is ADHD and my kid is autistic. I wonder. I mean, I don't have any data.
I simply don't know, Bill. I would um, I I would think most parents would be cautious because if you quote type your kid as being autistic, I mean, even though we've been talking about that maybe advantageous in venture capitalists or wherever,
Yes.
it could also be extremely deleterious. So, you're looking at
Yeah.
someone and you say, okay, well, he was diagnosed or she was diagnosed as being autistic. Do we want them in my workforce? So that would be, I'd be very leery of that. Yeah.
Yeah, I know. Yeah. Excellent. Yeah.
Okay.
So I think we're running out of time here, Ian. So yeah, we'll do it again next week.
Okay. Sounds good. All right, Gil.
Thank you.
See you. Bye bye.